So looking around the world, we're now seeing a number of countries shorten the isolation period for those infected with COVID-19. The CDC over in the U.S. has received a ton of criticism from the medical community for shortening the isolation rules, but not requiring a negative test in doing so. What is your read and what's your take on whether this is the right move from the CDC and from other governments around the world?
Well, as you'd expect, I look at this from my side of the fence, from immunology and virology, from where it looks like quite a tough balancing act, quite a tough gamble, because you need to look at the hard data about the proportion of people who will still be positive beyond 7 or 8 or 9 or 10 days, and still be symptomatic beyond that period. And so it's a very, very tough balancing act, not without risk.
One of the big questions right now, my understanding, is what happens to the Delta variant and the Delta wave in parallel to what happens with the Omicron variant. Based on the data you've seen, is immunity garnered from the Omicron variant going to provide protection against the Delta variant? And where are we going to be left when the Omicron wave peaks?
Yeah, so I think it's kind of complex immunology and a complex work in progress. So at the beginning, I think many of us felt a little bit bleak that all we'd done was to take a ghastly Delta wave that we hadn't dealt with and superimpose on top of it a much larger Omicron wave that we also couldn't deal with. And now we're starting to see, I think, some data that the antibodies induced by the so-called milder infection with Omicron can protect against Delta, and that would help to have Omicron displace Delta and move us along a little bit. So that's kind of work in progress.
Danny, you may feel bleak, but you never actually manage to sound that bleak, and you always give us a fairly upbeat message, so I appreciate that. Happy New Year, by the way, Dan. Dan, look, the mixtures of flu plus corona, the Israelis are finding some very interesting stuff there. Florona, I think. Delmicron, of course, a mix of Delta and Omicron as well. We're going to see more and more variants. Are you hopeful, given what you just said, actually, that there will be some form of mythical herd immunity building up for those of us that have had coronavirus and actually creating a situation where we're not going to have this oscillation between shutdowns and lockdowns and huge cases across the world? Are you more optimistic now that the new variants will be able to cope with them better?
I'm a tiny bit optimistic in terms of a kind of, slow creeping incremental exit strategy. We've got to be so fleet of foot, haven't we, in terms of constantly reappraising where we're headed, because it's non-trivial, and not least because the term herd immunity has been so misunderstood and abused, and we know from decades, centuries of the common cold that immunity to these things is very fleeting, it's very ephemeral, it doesn't last. But I think if we can get all the things we're doing at the moment sorted out and get our vaccination rates up and get our boosting rates up, I think 2022 can look better than 2021.